special. Wow.
Well, first of all, what is menopause?
Oh, that's a good one.
So menopause is when you haven't had a period for a full year, so 12 months without any bleeding, usually around the age of 50, 52. That's what we call menopause.
Do you need to have blood tests for your hormones to diagnose menopause?
You do not. The only definition is absence of your period for 12 months. The blood tests are extremely unreliable and they vary even from one day to the next. We could do the same blood test 2 days in a row and you would have completely different results. So unreliable to diagnose menopause.
And what is premenopause?
So menopause is that 12 years.
12 years, yeah, that's long.
Menopause is 12 months of no periods, but there's a whole period surrounding that can last for many years before and after that have symptoms similar to the ones of menopause, indicating that you will be in menopause soon.
So, and that's very important because that premenopause, like technically everybody is premenopause because technically it's everything that is before menopause. So menopause is 1 year of no bleeding. After that 1 year, you can finally say, set in stone, I am menopause. Before you get that 1 year, you are premenopause. So anybody that's not menopause, technically in terms, is premenopause. But now to really start talking about like that premenopause, basically as soon as you hit 40, you are in premenopause. So then yes, usually that age, that 40 and above, that transition period, your hormones are all over the place, and you can, not everybody, but you can have those menopausal symptoms, and then you can start to have irregular periods. Usually the cycle will start to shorten a little bit in the 40s before they start to elongate and get a longer cycle and start skipping. But before you get that skipping, usually you'll have like a shorter cycle. But that is all part of the premenopause. And then you will have change in moods. You can have insomnia, lack of sleep. Yes,
some
insomnia.
Hot flashes.
Brain fog is a common one. Just generalized fatigue. Irritability is one. And just general aches and pains. So you just have pain just like everywhere. So those are all symptoms of menopause that you can have in premenopause.
So what do we do about that if we're not officially menopause but we have all the symptoms?
So one, you do not need hormone testing just for that. Same as for menopause, those premenopausal symptoms, you don't necessarily need to check your hormones.
Okay.
And it is the same idea as menopause. So even if you're premenopause and you have those symptoms, we're going to treat it a little bit the same way. So first of all, it's just lifestyle. So you do have to exercise. The recommendation is 150 minutes per week of exercise, so that is all good. Yoga is especially good with the relaxation, and it helps with stress level, and it helps with symptoms of menopause, and hot flashes was actually proven to help exercise and yoga. Hydration, so to get your liter, or 2 to 3 I should say, of water intake per day.
Sleep.
To limit the caffeine.
We'll limit the caffeine.
And alcohol. So caffeine and alcohol and chocolate, so all the good stuff, is actually a trigger for like the hot flashes. So again, just be mindful that if you are having all of those, that it can increase your symptoms. Sleep, so it depends on your job, not mine. If you can, try to get a good sleep regimen in, if you can, but I know that one is a difficult one.
So what if I do all of that and I'm still miserable? Can you help me?
And that we can.
Oh.
So while you're premenopause, so like menopause or premenopause, so technically before menopause, if you wanted help, you can always just, again, hormones, but they can be taken like through birth control. So anything that is birth control is hormones, and that would definitely help your symptoms. Again, there are some contraindications to birth control, so we would have to review all of those. But if there is nothing that is contraindicated, then technically we could just use birth control because it is hormones and it would help all of those. We can also do hormonal replacement therapy. We can use hormone replacement therapy even in premenopause, same as menopause. Again, it is to treat the symptoms of menopause. As long as you don't have any contraindication, it is okay.
But should I get my hormone levels tested before going into hormone therapy?
No, because we are treating symptoms, not hormone levels.
Okay, just checking.
So we are treating the symptoms. So we will usually just prescribe one dose, and then we can modify, decrease or increase the dose or change the type of hormones depending on how you respond.
And one thing you said that really hit home with me was it's not one size fits all.
It is not one size fits all.
What do we do? Where do we start?
So we'll usually start with like what we say is like the how do I say that? It kind of
the lowest dose?
It kind of depends of what you want. So basically, you can take hormones either transdermally or you can take hormones by mouth, so with a pill form. So it kind of depends of the preference of the patient, depending on what the patient wants. And then on top of that, it depends of their health history. So if you're at higher risk of like strokes, blood clots, then I would probably prefer a transdermal route, so either a gel or a patch. If you have no risk factors at all, then like that you take the patch, the transderm, or the gel, which is transdermal, or you take the pill, then it is fine either way. Because then if you're less at risk, you're open to any of the options. Where was I going?
So there are medical options for my symptoms, even if I'm not completely menopaused. I do not have to have my hormone levels checked, but I do need to see a health professional because this is a prescription, right?
Exactly.
Okay.
And then we usually start with the standard dose. We can do the ultra low dose, but if you are just menopause recently, I would usually do the standard dose, and then I do modify based on symptoms. So I do let like 2-3 months go by, and then we modify either the type or the dose.
Okay, so if I'm still a little cranky after 1 week, that's okay.
That
right?
is
I have to wait
okay.
3 months. Okay.
And it's important to note that like all the symptoms of menopause, so like yes, the one that is really typical of menopause is the hot flashes. So the hormone replacement therapy is indicated for the hot flashes, but menopause is so much more than hot flashes. Like we had said, the lack of like the insomnia, irritability, so mood, the just generalized pain, the brain fog, but those are, you know, they're multifactorial. So the hot flashes is very much menopause and premenopause, but like the other ones can be multifactorial. So if those symptoms are related to menopause, they will be helped with the medication. If you see zero effect on those, then you have to look elsewhere. Because it's not those can be present for other reasons. So I always let them know that they could have help if they're menopause related.
Okay, so what if I start hormone therapy and I am very happy? How long can I continue?
So that is a good question. So technically, we usually say that, you know, you're going to take it for about 5 years, 5-7 years. But honestly, as long as you're good and healthy, you can stay with your hormones longer. It is always a decision to have with your family physician or your physician or gynecologist to reassess every year. So the need to stay on it or the need to try to take it off. But there's not actually like a time limit. So I've had people that are been on it for like more than 30 years and are still on it and happy on it.
No time limit.
No time limit.
Okay.